crucial point in time. Recent significant decline in global health funding has led to many African health systems being vulnerable. However, we believe it is an opportunity for us to build sustainable, equitable, and locally led driven health system. So far in our series, we have explored at the Roundtable 1, where are we as a continent assessing our current situation and ways in which we can reimagine our health system. At Roundtable 2, we explored ways in which we as a continent can maximize health using existing resources. Today, we'll be looking at another piece of the pie, which is how do we mobilize more resources for health? Recent global developments reinforce our agenda, such as the International Health Economic Association Congress 2025 and the recent Africa CDC concept note. We must, as a continent, mobilize more resources from health, from domestic resources and through innovative means. Today, our conversation will focus on ways African continents can expand their physical space for health and more. Let us leverage the latest evidence and global momentum to chart a sustainable pathway for health financing in Africa. We look forward to a session that is filled with bold ideas, practical insights, and clear next steps. I welcome you once again. Thank you. Moderating this session, we have Professor Otto Chabikuli, who is a seasoned global health expert with 30 years experience in research, teaching, and program management. He is currently an adjunct professor in global health at Howard University, USA. He formerly led Eastern and Southern African regional programs for the FHI 360 program. With him today is Dr. Osasui Drisu. She is the Executive Director of Policy Innovation Center, Nigeria, and a Senior Fellow of the Nigerian Economic Summit Group. She leads policy and behavioral interventions in governance, gender, health, and social inclusion. She has been named as one of Africa's top 100 leaders. Over to you now, Dr. Drisu.
Thank you so much, Dr. Ladele. Good afternoon, everyone. It's great to be here, and thank you so much for joining from all over the world. And welcome to Roundtable 3 of the Seizing the Moment, Africa's Roadmap to Self-Reliant Health Series, co-hosted by the African Health Catalyst Fund and African CDC, and also acknowledging the collaboration with partner organizations, cutting-edge public health solutions, EPI Solutions, African Hub for Innovation and Development, TNP Ahead, the Policy Innovation Center, Le Jardin des Zoe. This series, as Dr. Ladele has highlighted, has elicited actionable steps that would really see us moving African health systems beyond AIDS dependency. We don't have a choice, really, and the urgency of health systems transformation. Co-moderating with me today is Professor Otto Chabikuli, and you're welcome once again, sir. And our discussion today will focus on financing health systems in Africa without relying on external aid. How do we get more money for quality healthcare? We're not here to lament scarcity. We want to move beyond those lamentations. We want to really explore potential government, private sector, philanthropy, out-of-the-box solutions in our communities that can help us sustainably fund health systems So today's conversation is really a call to action. We look forward to being able to co-create a blueprint for sovereignty and smarter, innovative, homegrown investments on our continent. Before I introduce our esteemed panelists, I want to remind you of a few things. And firstly, French translation is available, and so you can listen to this also in French. Please use the Q&A button to ask questions throughout the session. We will bring them to the attention of our panelists in due course. Today, we'll start with a moderated conversation. Then we'll take some time to have questions that you pose using the question and answer function. And then we're also just going to have an open mic session where we can all share additional reflections and rich insights. I would like to introduce now our distinguished speakers and panelists. I'm going to start by introducing Dr. Maurice Atoki. She's the CEO of African Business Coalition for Health, and that is ABC Health. You're welcome, Dr. Atoki. And as I introduce her, I know that her profile is also being displayed on your screen. And then also, I would like to introduce Professor Justice Novignon, who is a professor of health economics at the University of Ghana. You're warmly welcome, sir. No, can I have Professor Atoki's, Dr. Atoki's, okay, Dr. Atoki's profile? Yeah, she's the Chief Executive Officer of African Business Coalition for Health, a non-profit social enterprise made up of African business leaders, and she's working hard to see how we can support governments in strengthening our continent's health system. She's also the facilitator of the Health Policy Commission of the Nigerian Economic Summit Group. And then I'm also introducing Professor Justice Novignon. He's a professor of health economics at the University of Ghana. He's the technical director for health economics and financing at MSH, and also a professor of health economics at the University of Ghana. Previously, he headed the Health Economics and Financing Division of Africa CDC in Addis Ababa. You are warmly welcome, sir. I also want to introduce Dr. Joseph Fokam, who is the Permanent Secretary, the National AIDS Control Committee, Ministry of Public Health, Cameroon. Dr. Joseph Fokam served as the Permanent Secretary of the National AIDS Control Committee at the Ministry of Public Health in Cameroon, and is also a senior lecturer of medical virology at the Faculty of Medicine and Biomedical Sciences, University of Yaoundé. And finally, I would like to introduce Dr. Elias Asfor, who is a health economist at African CDC. He is a health economist at the Division of Health Economics and Financing at Africa CDC, holding a PhD in economics from University of KwaZulu-Natal, South Africa, and also a research fellow at the Department of Economics. Previously, he was a researcher at Ethiopian Public Health Institute and technical advisor at the Ethiopian Ministry of Health. You are welcome, Dr. Elias. And right now, I have the distinguished pleasure of handing over to Professor Otto as we continue this very important panel discussion today. Over to you, Prof.
Okay, thank you so much for the introduction, and welcome again to the panelists and participants. This is going to be an interesting conversation. Anything to do with money, as you know, is always interesting. And I want to share with you first my impatience. As time goes by, I become increasingly impatient with the slow pace of development on the continent, and I'm sure this is a feeling that many of us today around this table we share. We want to see development moving really fast. Now, consider this, that every time one talk about health financing, for instance, we remember that it's not something that is new. There was this thing called Abuja target. 15% of each of country resources budget supposed to be dedicated to health. but very few countries have managed to reach that. And why? The question is, why is it that we are struggling to reach a commitment that everybody understands it is important, but mobilizing these resources domestically, it seems to be a problem. And obviously, we can look at all the challenges and so on, and maybe that is the good place to start from where you're coming from your experience. Looking back at your countries, what do you see as a challenge that many of our countries are faced to reaching this commitment that was made to everybody, that by a certain date, there will be this target that will be reached at 15% of the budget allocated to health financing? So I'll give all the panelists a chance to talk about your experience and your comments and your observations about that particular challenge the continent has faced. No, in no particular order.
Okay, so maybe can I start?
Please go ahead, Dr. Foko.
Thank you. Thank you very much, Professor Otto. It's really a pleasure being here today, despite our respective tight schedule. We really know Africa is undergoing a series of transformation, among which also we have a transition towards a greater leadership in terms of global health agenda. So just to share a very brief summary from the Cameroonian experience, here we are talking about health financing. And health financing, first of all, is based on knowing your epidemic. So it is very important for every country to, first of all, to know their epidemic. And knowing your epidemic, it means setting up a good agenda as we move towards elimination of those diseases of public health importance. And all of these African countries, in terms of programmatic intervention, we are going towards the end of emergency response for health program. So we should be achieving our target to end our health emergency response by the end of 2025. So we have just a few months to meet up with this agenda. But obviously, it is very difficult for all the countries to achieve the set target for emergency response for the emergency response agenda. However, we expect that most of these countries will achieve this target. So between 2025 and 2030, this is going to be a transition phase. And the major difference in health program, when we talk of transition phase and the emergency response phase, during the emergency response phase, we rely more on external donors. That's what have been happening in Africa and in other LMIC. So moving from this emergency response phase where we rely on external donors, we are now entering what we call the transition phase towards elimination. And as we enter this transition phase towards elimination, we are not just transitioning leadership. So this leadership from the external financing towards the local ownership of the skills, local ownership of program governance, and also local ownership of the financing. And beyond 2030, where we expect that all the African programs in terms of global health agenda should have achieved elimination, that's where we'll be entering what we really call the sustainability agenda for Africa, a period during which we believe African countries should be able to have almost complete leadership in terms of global health agenda in their context. So when we look at this whole component, the milestone we have ahead of time, we really believe this meeting is timing. Timing, why? Because we really want to see how to make sure no one is left behind. You have talked about the Abuja Declaration. Very few countries have achieved those declarations. Cameroon also is among those countries where we are still lagging behind. So I'm just trying to set the scene with this context, how we are helping countries as program managers to move along together with this agenda. Thank you. Maybe I'll stop. I'll stop at the moment.
Oh, thank you so much, Dr. Fokam, for that description of what's happening in Cameroon. But Dr. Morris, maybe if you can come in with your observation from Nigeria, particularly that the Abuja Declaration is named after Nigeria city. One would expect Nigeria to lead the way, but it doesn't seem like Nigeria has also managed to get to the target of 15% allocation of budget to the health sector. What in your experience would explain what kind of challenges the Nigerian government is facing toward reaching that target? Over to you, Dr. Toki.
I actually assumed that you will call me last because I killed my camera. But yes, thank you for the question, Prof. I think that there's just a lot we talk about resource mobilization without paying enough attention to the characters of those and the peculiarities of the different resources at a Nigerian level and at an African level. And I say this because largely there's a shift going on. Again, we can agree that COVID-19 is really respectfully added to that new paradigm. But it's also really important to put a name to the gap. Now, the major gap, as far as I think that, accessing funding is, and maybe one of the reasons for the failures of us achieving the Abuja Declaration of 15%, is because nobody is being responsible to help connect the dots. So private sector has been largely identified as the next source. So besides what has ever entailed an international donor in time past, we all know that economically, and for Africa especially, private sector in some areas are doing really quite well. And so it's to be able to charge that kind of success also to the health space. And so really paying attention to the untapped engine for domestic resource mobilization that private sector has the capacity to bring. So it can be through corporate donations, via co-investment, enterprise financing, demand-driven innovation, and so on. So I say this because what I see a lot of is us not accepting that donations is fading away and fading away fast. It's no longer in another 5 years, in another 10 years, there probably will be nothing to take from. And so it's us taking the responsibility and saying where else is the potential capital or the potential funding. I like the fact that we're using money in this theme and in this topic. So again, so for us in ABC Health, and I don't know if you know, but we are a coalition of business leaders from across sectors. So we're not majorly health. We are for health from different sectors, so the financial services, manufacturing sector, oil and gas, telecoms, and so on and so forth. And one of my roles is to identify what the health sector needs that we believe is already existing in the other multi-sectors, so that we can use our competencies as resources and mobilize them to support strengthening health sector. So again, from areas like blended finance structures to de-risk private investment, that's a big solution. That's a big structure that entails, in the private sector, and that has worked, to also dedicated investment platforms that crowd in private capital. So these are things that have worked in non-health sector. Fiscal reforms to incentive health-aligned private expenditure, again, CSR tax credits tied to health impact outcomes, things that we've seen work in some environments. And these are things that we can channel our minds towards. More particularly, and I'm so glad that we have professors of health economics and doctors of health economics here on this platform. It's imperative that as a nation, Nigeria, and perhaps even as a continent, we begin to relook at our curriculum in the medical school and not tailor it after, not in some areas, after the advanced environment, but be a bit more local and customized in our approaches. And I say this because largely we see the need for more medical students and doctors to understand the dynamics of how to harness private sector money. There's a gap. It's strange to them. So again, a medical student finishes school, he wants to come into the society, he wants to bring his solutions. He's used to expecting government to be able to create the platform. He's used to relying on donor money. But the thing is that private sector money is not like that.
Right.
It has its own characters and it has its own features.
Yeah.
So he needs to understand better what debt is and what equity is.
Maybe we save some of this really good insight into when we talk about the private sector, because I promise you that is going to be a big part of this conversation. I really like you're reminding us that maybe part of the Abuja Declaration was overly focused on the national fiscal revenue stream, and we hadn't paid attention to the non-governmental, non-fiscal space, which is the private sector, where there's a lot of resources yet untapped. And we will get to that conversation as the webinar progresses. Thank you so much for those insights, Dr. Atoke. So, Prof. Novinyon, if I can come to you, Ghana, democracy, good governance, a lot of good things are happening from that perspective. And Ghana is really well regarded as a model in so many different ways. But however, again, staying with the Abuja Declaration and the struggle of our countries to meet those declarations, what has been your observation about what stood in the way of Ghana to meeting that obligation?
Thank you very much, Prof. Chabeluki. I concur with comments by previous colleagues. It's important to take a step back and recognize that what we call the Abuja Declaration actually came out of a meeting specifically deliberating HIV/AIDS, TB, and other infectious diseases in 2001, right? So that was the context of that meeting, facilitated by, chaired by Excellency Obasanjo in 2001. And this is important because we know, and then of course, this was coming on the heels of the Millennium Development Goals. We all know the aspirations we had around the Millennium Development Goals. And so this is important as a context. In 2001, the World Bank indicates that 39 countries in Africa were low income, not lower middle income, low income countries, 39. Now, fast forward 2025, there are 21 countries. So that number has gone down by almost half. And so I'm making the point that we've seen significant improvements in the sizes of our economies over the 24-year period we are talking about. And so we would have expected to see a lot more improvements in financing. And let me also highlight that when we talk about health financing, for us, the importance, it's key to emphasize sustainability. It's key to emphasize that this will need to be in a way that goes on into the future. And so once you bring sustainability in, you automatically knock off donations. I mean, donations are never sustainable because they are the mercies of whoever is donating. And so the problem that Ghana has faced over the period, like other African countries, is really a combination of economic challenges, but also political, if I want to put it that way, political prioritization. Political because given the pace of our country's growth, I mean, 2001, Ghana was a low-income country with a GDP of less than 1,000, GDP per capita of less than 1,000. Now, we've grown more or less twice, more than twice, with a GDP of more than 2,000 to fall within the classification of lower middle income country. But we have not seen the appropriate, the ambition and the appropriate prioritization of political leaders for health. And this is the case for many of our countries. So that's one. But we also need to acknowledge that a lot has been happening in the economic space. Our countries have become much richer, but they've also become more burdened with health, with debts. So Ghana, I think 2 years ago, had a debt to GDP ratio of close to 100%, maybe 80 something percent, which means that most of the monies that came to the country actually went in servicing debts, right? And there's this beautiful report by the UN, which shows that, in fact, most of our countries, not just in Africa, but most low and middle income countries, spend more money servicing debt, particularly in Africa, than we spend on health. So I wanted to lay this. I know we will go into a bit more conversations, but these foundations are very important as we begin to think about what can our countries do, and the issue of sustainability as we begin to think about what should our countries do to ensure that health financing is more sustainable, and as we expand the base source of this. So I would like to end here because I know there's a long day ahead of us.
Oh, absolutely, absolutely. And you've just opened a number of very important and exciting windows, which are retained. For instance, the need for sustainability and the donor reliance is not the way to go. The things that are standing in the way in terms of prioritization and political will, that hasn't really allowed us to go there. But more importantly, this kind of dilemma that you just touched on, of saying we've become more wealthy, our economies have progressed, but at the same time, we encumbered ourselves with debt. And that really hamstrings and shackles our government ability to spend in areas like health and so on. But we're going to come back to that definitely. But before we do that, Dr. Asfar, if you can tell us a little bit about what Africa CDC is preparing for the continent. I know there's a lot of conversation and thinking that is happening, is underway from Africa CDC perspective. And if you can just briefly tell us about the key pillars of the framework that Africa CDC is thinking about, we'll truly appreciate. Over to you, Dr. Asfar. Is Dr. Elias with us? Dr. Elias, if you're speaking, we can't hear you. All right. Maybe we should move on while waiting for Dr. Asfar to join. Yeah, I'll just hand over maybe the mic to Dr. Dirisu to speak about the second theme for this conversation. Over to you, Dr. Dirisu.
Thank you so much. Thank you so much, Professor Otto. Moving on this interesting conversation, I mean, we've laid a foundation for trying to understand why we have not met this target. And we also see, for example, that even a lot of the reforms going on are actually borrowed from global models. And this limits our ability to adapt and really develop homegrown solutions that work. I was in a meeting this morning, and they were describing an innovation that the sort of imported version costs like 4 to 5 times now the local solution that is being deployed. So we want to quickly have a conversation about homegrown solutions. But now that Dr. Elias is back, Dr. Elias, just taking you back quickly to round up the question that Prof was asking about what is Africa CDC proposing to mobilize more money for health before we jump into homegrown solutions.
Thank you so much, moderator. Sorry, my connection went drop off. So I think basically, as the distinguished panelists highlighted, there are different contexts as Africa we are facing, especially in the health financing architect. And then I think clearly being the position of the Africa CDC as a technical agency within the Africa Union, there is a big effort in the health financing to coordinate a continental effort. For instance, we can mention that Africa CDC advocates, promotes the new public health order, which clearly outline the health financing for health security. And most importantly, recently, Africa CDC also shared a new concept paper by the name Health Financing in a New Era, which highlighted clearly 3 main thematic areas that we need to focus as a continent. First, as we have been discussing, to push countries to meet the Abuja target through different approaches, leveraging the Africa CDC, the Africa Union platforms and the dialogues with the AU head of states. And the second one is on innovative, looking for different means of innovative financing mechanisms. Still, that I think still a different types of data and evidence will be required, but we clearly outlined also different proposed solution on innovative financing. And then the third one, we clearly also outlined the blended financing to tap the resource from the private sector, and then most importantly as well, to invest more on the infrastructure, supply chain, local manufacturing. So these are like a big backbone for the health system. So I think overall, Africa CDC is pushing to have a coordinated continental effort to push the agenda on the health financing, and still that should be backed by a country level commitment, so that we can address all the problems at a different layer. Yeah, let me pause for now. Thanks.
Wow, amazing. Thank you so much, because you have laid the perfect foundation for the second question. Thank you so much, Dr. Elias. And just building on what Dr. Elias has been talking about, innovative financing mechanisms that work for us and are sustainable. He also talked about local manufacturing, the example I just gave about cutting production costs from, for example, $10 to $2, increasing local manufacturing, and then saving a lot more money for health. We want to learn now. We're just moving on to quickly see how we can learn what sort of homegrown initiatives, and I'm going to be calling on Dr. Morris to start. And we just want to learn what is working right now, for example, in Nigeria, in terms of homegrown initiatives, local approaches to health financing, and what lessons are we learning from this that can now help us to think about deployment at scale on the continent. So first of all, what is working? Because we want to be positive. What can we learn from what is working to begin to think about what scale means for us in Africa? Dr. Morris.
All right, thank you so much, Doc, and once again, thank you for having us here. What is working? So one of the things that we see a bit of movement around is public-private partnerships. And I think it's working because it's almost a deflective area to think about solving some of these, problems and challenges that we have in improving health outcomes. Now, the PPP model, as we all agree, is such that it still understands and projects that government responsibility for public health is not undermined. But the private sector competencies can be harnessed in a partnership that both parties, can both actually benefit around. So I would largely say, I mean, I'm a big advocate on public-private partnerships. It's hard, we're not there yet, but it's a model that should be heavily explored to work. Public sector still has the power to generate demand and ensure that the services and the innovations and the solutions that innovators and entrepreneurs bring in the health sector can actually do their work and do what needs to be done. There are a lot of solutions we still see out there and ideas, great ideas, by the way. And sometimes when they go to the field, it's not fit for purpose. And it's not fit because a lot of homework has not been done on understanding how to stimulate demand. So for me, directly to your question, is to be public-private partnership. A big area we need to considerably look at is, and kind of just aggregate also energy at, is to create regulatory pathways that allow private capital to scale health innovations without burdensome bureaucracy or fragmented policies. This needs to work, and government needs to do more in this direction. It's not clear now. So again, over time, in the last couple of years, digital health has been garnering attention. But do we have matching regulatory frameworks and pathways for it yet as a continent? Not likely. It's an evolving space. And so sometimes we're not even sure we want to blame the government particularly for it. It's almost as if we're all pioneers and we have to struggle through to be able to properly articulate what this is and how we must maximize those solutions.
Okay,
Another
thank you,
one.
Dr. Morris.
Okay, please.
Yeah, so sorry, but I'm taking that public-private partnership strongly. How can this work better? How can we get government to support? And how do we get innovations in digital health? And what sort of infrastructural and regulatory opportunities exist for us to scale digital solutions? I'm going to flip this question now to Ghana and then just ask Prof to wade in, leveraging on some of the conversations we started with Dr. Morris. What homegrown solutions are working in Ghana, and how do we begin to think about deploying some of these solutions at scale?
Thank you very much. I also believe that PPPs are largely untapped, for sure, and we need to revisit that concept. But I want to draw our attention also to the fact that when we talk about community-based health insurance, right? Today they've metamorphosed into into social insurance and nationwide insurance. But community-based health insurance was an innovation. It was an innovation that did not come even from the country level. It came from communities. This was communities, if you come to Ghana, specific areas, within the communities coming together to recognize that, look, we need to save ourselves because we cannot wait for government to save us. We cannot continue to see, Our neighbors get detained at health facilities and die. So we need to rise. What did they do? They rose. They came together to find a way, contribute resources from their own small ways. And many evaluations show that this actually worked very well. I mean, there were challenges in many places, but these worked quite well. And for most of our countries today that are moving towards a social health insurance, it's basically improving the community-based insurance. But of course, as you widen it, the challenges also become bigger. And I want to demystify the thinking that in today's Africa, in a typical African country today, social health insurance is a very good source of raising revenue. I've heard many policymakers say this. People say we will introduce health insurance because we believe it will raise more money for us to finance the health sector. The evidence does not support that. Social health insurance is great. It works when we get a government to commit resources, to commit some, earmarked funding. And so it's a way to get governments to put in a bit more. But it has not been the best way to get communities to raise funding, because at most 3 to 5% of money has come from premiums, and that in itself has not been very efficient. So I think we need to go back to the drawing board, like our communities did in the early 80s, in the mid 80s. They saw the problem. Today our problems are bigger. We should not expect solutions from someone sitting outside. What can social insurance do? What can social insurance not do? Many of our countries, also like Ghana introduced the COVID-19 levy, which unfortunately is being abolished now. Some of us are not so much for abolishing that. We believe that countries will need to take a bolder step to commit more and more of their own tax-based resources first, and then engage the private sector, and then engage other people. But let me end by saying again that if we are not very specific when we talk about private resources, some of these end up being resources from households' pockets. We do not want to see households pay more and more out of pocket because
get poorer
because these have not been successful. We do want to see governments raise more. We do want to see governments work with the private sector, especially the extractives and other industries, to raise more for financing.
Thank you so much, sir. I mean, I'm taking a very big nugget out of what you have said. The social health insurance and all the community-based insurance programs should not replace government commitment and investment into health. It's different. So once we go that route, we'll end up having less money for health, and that's not why we're here. And thank you so much. Finally, I'd just like to, on this question, just ask Dr. Fokam to just quickly share some insights as to what new thing is working in Cameroon. We've heard about PPP from Dr. Atoki. We've heard about this beautiful homegrown solution of community health insurance from Prof in Ghana. What's happening in Cameroon that we can learn from and deploy at scale on our continent?
Yes, effectively, in the Cameroonian context, we believe if we really have to sustain our response towards health need, the very first thing is to develop a sustainability roadmap. A sustainability roadmap should be a guiding principle where you have components on political leadership. Without political leadership, there is no way we are going to achieve our sustainability agenda. Then in the Cameroonian context, for example, once we had the reduction in this external funding, what we did was to develop a contingency plan. And this contingency plan was made to close any gap that was left over by our external donors, be it the US government, be it Gavi, or whatever gaps we had during this period. We developed that contingency plan of about 30.7 billion local currency, which has really helped the country to ensure continuous services without any interruption. So that was the first thing we did. This is our contingency plan. And based on this, we were able to raise the government contribution from what we had just like 5% on the health system. A bit, we are now going towards that 10% rate. But again, this was mainly a contingency plan. So this contingency plan is made to solve a immediate problem. So we are now developing what we call an integrated sustainability plan. This integrated sustainability plan is made to put together all what we have like needs for the major health program. I'm happy with the comment from Ghana with Professor Novinho, which he really highlight HIV, TB, and malaria as the entry point, and this is true. But now in Cameroon, beyond these three major programs, we are also bringing in the enlarged program for immunizations, where we know we will always need to provide vaccine for our children. So in this sustainability roadmap, our very first political commitment is to make sure we should increase the domestic contribution. So domestic contribution definitely in Cameroon is going to increase, but I can't really give you the exact value, but it is already increasing. Secondly, we also opt for other contributions that could be sustainable. We know most of our countries, yes, like Ghana, also Cameroon, GDP is now around 3.6%. So we are no more really a low or maybe a very low resource country. So we are at the level of low middle income countries, yes. So which means there are some of those activities that we can also contribute while the donor is stepping down gradually. So what we are actually advocating for in Cameroon, and that we believe it may have a presidential endorsement and it may also get into our law, is to see how we can implement a herd-related tax. Herd-related taxation is a procedure whereby on any product that we buy, we may have 1% that is allocated to herd product. We believe this is one of the very sustainable mechanism for herd financing in Africa. Why? Because when we look at social insurance, the contribution is still low. I'm not saying it's negligible, but it's still low. When we look at providing taxation only to those who are civil servants in Africa, they are not even more than 5% of the overall population. So, but now we want to look at an area where we believe everybody is almost using those services. So we believe providing some tax on some of those common goods that we use routinely may also give us a possibility for a sustainable financing. People think also about issues like telephone communication, yes, but when we move out from the financial contribution, I heard about PPP. There is also in-kind contribution for PPP. An example of in-kind contribution that we are seeing for PPP is from. Yeah. Hello?
So thank you so much. Thank you so much, Dr. Fokam. I'm so
Hello.
sorry I have to pause. We will have another opportunity to reflect on the next round, but you have shared very powerful insights. There's so much we can learn from the sustainability roadmap to thinking about how Cameroon developed the contingency plan to raise government contributions. That's so laudable. And then this new innovation around health-related tax, 1% allocation to health products. Really, really fantastic insights. I'm going to hand over back to Professor Otto now to layer on what we have just finished learning from this session. Over to you, Prof.
I think it's getting even more exciting now because we are moving from the what to the how. And this has been, many people would criticize, development practitioners, is that, sometimes we spend a lot of time describing the what need to be done. But the question is how. Okay, so we've agreed that the fiscal space is smaller for the need to finance in a sustainable way, domestic health needs. And we need to go into to the private sector, which is not yet optimally mobilized. The question is, how do we get there? The private sector is growing. There's more wealth on the continent. The philanthropic sector is also growing. We've got a lot of high value net individuals on the continent and millionaires. Now, the question that I want to put back to maybe Dr. Elias is, in your experience, how should we practically approach these untapped resources in the private and philanthropic sector? And Dr. Atoke, obviously, I know this is really your bread and butter. If you have something to contribute after Dr. Elias has shared in his insights, you will be welcome. Dr. Elias, over to you. From the Africa CDC perspective, how do you see this?
Thank you so much, moderator. This is really the question that we need to address, because the how part is the one that will drive us to action. So I think basically I would like to reflect what critical steps that Africa CDC did in this context. Basically, I think I would like to mention the launch of the Africa Epidemic Fund. I would like to emphasize that one. So we can consider that as a homegrown solution. So for any public health emergency happening in the continent, we are aiming to raise resources, being, co-hosted with Africa Union Commission as well as with AU NEPAD, so that I think we have, our own sustainable means. So I think these types of solutions, like the actions, including the Africa Epidemic Fund, recently also the pool procurement mechanism that Africa CDC is pushing, are like a critical steps for the continent as well as for all the AU member states, so that we have a resilient health system in terms of the healthcare delivery as well as for sustainability. And then the other thing is, it's good to have, because here we are talking about more money for health. We need to have an increased allocation of budget to health. So we need to create a platform. As Africa CDC, we are working to create a platform where the Minister of Finance and the Minister of Health will sit together for roundtable policy discussions. That would really help us, to showcase that health is not only a consumption good, right? So it is also a capital good. So that sort of creating a platform also is a critical steps for member states, so that we have an increased allocation of, and then I think finally, as Africa CDC, we are also promoting to have efficiency, because like you cannot ask the Minister of Finance to increase for your budget while your budget execution or your efficiency is at a lower level. So we are working to have a continental framework, at the same time to have an evidence-informed priority setting to support member states towards resource optimization. So all this, I think, critical steps would really help and can be more applied, but I will let for other colleagues to touch base about the PPP and the private sector engagement. Thank you.
No, this is really encouraging. And, Dr. Atoke, before you come in, I want us to break it down to, that community-based small organization that is struggling to raise funds to look after community members in the village. And they only hear that, every newly minted millionaire on the continent, the first thing they do, they start a foundations. So we've got 130,000 millionaires and billionaires on the continent right now, and the numbers is rising. Everyone has got their own foundation, fragmented sector, not really taking into advantage the economy of scale, like Africa CDC, you're mentioning the pool procurement, but in the philanthropic sector, we don't see that synergy coordination happening. I know there are platforms that is trying to bring people together, but how do we help these new budding, growing sector to mature to the level of the European and American philanthropy that is really well organized and well managed? From your perspective, Dr. Atoke, how do you see the way forward, and how do we engage with philanthropy and the private sector? And speak to me as if I was this old lady in the village.
All right, thank you so much, Prof. I think it's a combination of efforts. Some of them, unfortunately, we've not even deciphered yet until it really starts happening. And that's where we can tell what the gaps are and what we should do more of and less of. But more importantly is our capacity to unlock unlikely alliances. We need to understand that it's not the norm. It's just it's a solution that we're trying to make work. And so we must redefine our knowledge and our understanding of how private sector engages. So beyond traditional actors, you would know that private sector, like the hospitals and the HMOs that we know, there are also non-medic actors, like fintech, like logistics, like telecoms, like the financial service industry, and of course the philanthropy that you mentioned a lot of. And all of these have relevance. We're beneficiaries and stakeholders in the health systems that we all want to impact positively on. So some of the models I think we must learn to emulate will be corporate venture co-investment platforms. Again, private sector, private health and non-health need to see more of where the attractiveness is that link anchor firms with local health startups. For private sector, largely beyond the philanthropy model, it's about making profit. And so we need to, first of all, accept this reality. Hiding around it and saying, oh, you could bring your CSR and all of that, it's not where the big numbers will happen. Because again, there's little you can do to channel CSR into particular health burdens or to close particular gaps. There's also the diaspora health bonds tapping into Africa's 95 billion annually remittance market. That's a big market. And so looking at even both of these, coupled with philanthropic capitalism from high network Africans, these are areas we can largely consider. So I'm not a big advocate for philanthropism because, again, I think it's the one area where I believe it might be hard to really put a structure to it. But when you talk about harnessing the investment opportunities and making regulatory enablers such as tax incentives accessible while at it, then these are things that I believe have really growth potentials. We must look at things like investment protection laws to attract the investors that we want to come into the health community or the health systems. We must also realize that we're competing against other sectors when it comes to private sector choices. And so the driving force will be the economic, whether it makes a business case or economic sense for a potential investor. And that needs to be real. So without us having an enabling environment that works, the protection laws, incentive mechanisms, that are attractive for the investors, then we're still not really paying attention to what private sector requires to be in this game. There needs to be result-based financing models because they are needed to make health a viable and investable asset class. Without all of that in the mix, we're not talking to private sector yet. And Prof, I think I hear you a bit, so I'm going to have to leave it there.
No, absolutely. I think, the old lady in me understood very clearly that you are not going to start talking to the private sector if you don't think like the private sector, right? And we need kind of to almost educate ourselves on the way the private sector thinks in order to connect and engage with them meaningfully and sustainably. Otherwise, we'll be demanding one thing, and that is exactly not where their interests lie. So absolutely spot on. And I think you should develop a curriculum to train people on the continent about that. Now I'm going to pass the mic to my co-moderator to talk about the other aspect of the how, which is how do we do all of this in a fair, accountable, and transparent way. Over to you, Dr. Deris.
Thank you so much, Prof. We've had really rich conversations, and thank you, Dr. Atoki, for putting us on the spot with understanding how the private sector would engage. And quickly, just in a minute, we would just like to ensure that we're having a conversation about accountability. And many times we talk about very beautiful homegrown solutions, and how do we ensure that we're designing for the poor. Prof transformed himself into an old lady in the community a few minutes ago. And how do we ensure that we maximize opportunities to drive transparency in the system? What sort of digital financial management tools can we use and utilize in ways that really help us to drive accountability in the sector? So I'll start quickly with Dr. Fokam, and I'm just trying to understand what and you really challenged us today with a lot that is happening in your country. What about accountability? What mechanisms need to be in place to ensure that all these beautiful, wonderful reforms we've been talking about are actually credible, transparent, and truly sustainable beyond the beautiful documents that describe sustainability plans? What do we really need to begin to do to institutionalize accountability within our reform context? Over to you in just a couple of minutes, so we can take questions.
Yes,
also.
thank you very much, Jirisu. Really, for a couple of minutes, accountability in our context, even without being an expert accountant, we really need to set up specific key performance indicators with which we are going to really appreciate efficiency in what we do. I heard about efficiency from Africa, CDC. I heard about efficiency from the PPP point of view, having in mind that we generally rely mostly on the enterprise social responsibility, which is not yet optimal in our context, but we believe there is an area where we can have a maximum accountability in terms of implementation, and this is local manufacturing. Local manufacturing is an area where we will have easy accountability. We can reduce from $2 to $1 the cost of a health product, and we can start in Africa for those major public health diseases to produce mosquito bed net, and the impact will be there. To produce antiretrovirus, and the impact will be there. To produce vaccine that we use daily for our children, and for now only 1% is being produced in Africa, which means we have 99% lost on benefit that we could use to trigger a quicker development in Africa. So I believe in terms of accountability, this is a major area where if we implement local manufacturing, the business people, they will see their interest, the government will see its interest, and the community also, they will feel the impact. Let me end there. Thank you.
Thank you so much, sir. We've talked so much about local manufacturing today, and that is the way to go. We'll reduce costs, we increase accountability. I'll just quickly hand over to Professor Justice in a couple of minutes. What should accountability look like in Africa?
Thank you very much. For me, the biggest form of accountability is actually So it's shifting the conversation from we need more money to actually how is the money used and what is it used for? How efficient are we in spending? If you go back to the Abuja Declaration, as I answered earlier on through the chart, the declaration before it says we'll commit 15%, it says we will use the resources we have efficiently and effectively. So the question is the little resources that we have, how do the populace or the population see us using them? And this has also been a challenge with African populations. If you look at the Afrobarometer surveys, people are not necessarily against taxes, but they like to see what the taxes are used for. Transparency, ensuring that we have mechanisms that help us determine how we prioritize decisions we make around the use of resources. How do we prioritize the resources and where do we channel them? People like to see the resources in action, especially when we are collecting money from people, issues, I mean, in health financing, the public financial management mechanism, there are several approaches that ensure that, governments can account judiciously of the money that they use. If we are talking about money moving from the national level or federal level to state levels to finance health, who is tracking such resources, who is tracking how much is going, but also who is tracking what it is used for at the local level. If I send ₦1 billion, to a local government area to implement certain health services, how would I know if $1 billion was actually used? So we lack resource tracking capacity. And so we are unable to track even our own resources that we send down there, let alone donor resources that are being spent within our countries. So resource tracking is a very important mechanism to ensure that we can account for the resources that we use, but also transparency in the use of these resources, in decision making and in determining where these resources go to. In the end, it's not so much how much we have, but how well they have been used for my grandmother in the village to actually benefit and to have her health improved. So we need to bear in mind, as we call for more money, we need to realize that more money alone doesn't solve the problem. How the money is used or wasted is what will solve or worsen the problem. Over.
Thank you so much. And this is a really good place to consolidate on accountability. It's not just enough to ask for more money. It's really how this more money would also benefit. And one of the things we need to think about, we've heard of local manufacturing. Now we've heard of resource tracking capacities. That's where digital financial management tools come in, tracking disbursements, tracking utilization, and just ensuring that we have an integrated mechanism for closing the loop from when more money is released for health to that more money now benefiting that old lady in the village. And with that, I'll hand over to Professor Otto so we can have some Q&A. Over.
No, thank you again. I mean, most of us will agree that each and every important point that was raised here can be a topic of another webinar on their own. It is just, we're just opening up the areas of interest and we can dive even deeper. Now we're moving to the next question, which is the Q&A session. I see we have posted a number of questions here because this has to be interactive between the audience and the panel as well. Some here I see are questions, other just comment. Simon Ziba says, indeed, health insurance is key in addressing funds. Insurance being a pool fund, this could really help to bridge the gap in private sector is key, such as microfinance institution. That is Simon Ziba from Zambia. And then Michael has a question. In light of these insightful discussions, how do we begin to drive the consciousness of the need for Africa to become medically self-reliant among our political class, especially considering that even donations from the Western countries were largely driven by the political will of their leaders, and it was also political will that influence the deployment of those donations. Anyone on the panel want to tackle this important question about how do we engage politicians, because ultimately they play an important role? Anyone want to tackle this?
Can I come in, Prof?
Sure, please, Dr. Elias.
Yeah. So I think basically, thank you so much. The political will is like a motor for achieving any initiative that you may have, both at the country level, at the same time at the continental level. So I think I would like to mention the activities has been done at the Africa CDC level, which I mentioned earlier. You know, we developed a roundtable discussion between the Minister of Finance and then the Minister of Health. That really helps to shape, the thinking, as I have said it earlier, that okay, health is more of a capital good, not only a consumption. So such sort of a policy dialogue really also transforms, the political will at the continental level, but still, different engagements supported by evidences should be much more available, to change the thinking among our policy makers. So, you can see the example from Rwanda, for
Oh, did I lose you? We lost Dr. Elias. Okay. We'll come back to you, Dr. Elias, when the connection will come back. We've got Obioma Obikeze, who posted a comment that I would like maybe Prof. Justice to tackle a bit. Rather, developing economies ought to do, Obioma says, I do not see any self-reliance in healthcare financing anchored on donor funding. Rather, developing economies ought to do more work in exploring opportunities in domestic resource mobilization for health, especially from the side of strong public finance management and its associated efficiency gains. In other words, efficiency gains, you just spoke to it as a way of ensuring transparency and accountability, right? How we use the money. But Obioma is also adding the fact that efficiency gains is also saving money, you get more money. Would you concur with that?
Absolutely. Absolutely. Efficiency gains. So efficiency gains, well, comes from efficiency. The gains will come from being efficient. If you use the monies, if you had 1 million naira or cedis, and you knew that actually, if you were very efficient, if there was no corruption, and I see Dr. Agongo's comment on corruption, this was used transparently, you could actually only use 500,000. Now, the efficiency gains is the other 500,000 you are not wasting. Otherwise, if you had used 1 million, wastefully, then you wouldn't have much. So efficiency gains are the same. And I think that is where we need to really see in our context, there's a lot of waste, so much waste going to corruption through the procurement systems. We keep having new procurement laws. Unfortunately, some of these laws promote corruption in many ways. And I think that is where we really need to dig and tackle corruption head on. I mean, corruption is not a health sector specific problem, but it's a societal problem that eats into the health sector. And for us to accurately tackle health resources and improve population health, this is where people would see that if $1 could have been used to support an old woman, receive a service somewhere and is going through corruption to the back door, then it means that old woman is not going to get a service. So I think the way we communicate this, not only to the politicians, but also to the community, would make all of us, open our eyes and ensure that corruption would not destroy our health sector as it is currently doing now in terms of finance.
Totally. It is almost like, before continuing to mop the floor, we should fix the roof, right? And then Mary Kariuki, she agrees that, she puts forward to us that the investment in health require a lot of resources. That's true, but it's only one solution. We need proper planning for systems, infrastructure, growth, and research for sustainability. In other words, the word sustainability, we're just branding it about, but it requires investment. Would you agree with that, Dr. Fokam? Investment in planning for systems, infrastructure, growth, research, most of which is not available. Dr. Fokam.
I fully agree, Professor Otto. And again, because the sustainability agenda has 5 major pillars, among which you have the political leadership, you also have sustainable and equitable financing. You also have what we call a system. We also have services and solution. Then lastly, in the sustainability agenda, we also have what we call there is one very last component, enabling laws and policy. And that's why I very much agree with your previous comment. How do we engage politicians on board for this? So I believe if African countries can develop a very good policy brief that will be addressed to our head of state, this is going to also contribute substantially in achieving this goal. Then also advocacy towards members of parliament. That's where the laws are being taken, and at times we neglect them. Talking to parliamentarians will also help, for example, getting a legal framework for universal health coverage. And this legal framework, once it is already established by a law, it means even beyond a new president, that law will still be maintained and sustainability will be ensured. Thank you.
Absolutely. No, thank you for sharing that. And then we've got Nazir Pandor from Zambia, who shares that Zambia also has created stabilization fund, so concurring with the experience in Cameroon. And Chris Ngwa has a question that I think Dr. Atoki may want to take. How can African governments design tax policies that mobilize resources for health without worsening health inequities or limiting access to essential services, especially for the most vulnerable populations? Because sometimes domestic resource mobilization, we equate it with more tax. And in other words, Chris Ngwai say maybe this can also perpetuate inequalities if we bring in more tax. Dr. Atoki, what do you think? And maybe Dr. Elias as well.
I don't think so. I think that if we're focused on making sure that those tax policies are, instead of them being, punitive, they are helping to generate revenue that are targeted into the right direction, it will be a win-win. So for me, again, political will is a very critical component of all of these conversations. And unfortunately, in some African countries, we don't have enough of that. Starting from Nigeria when it comes to health. Again, I would think that that's one of why the Abuja Declaration hasn't, effectively worked. But one of the things I wanted to talk to was the fact that we don't also do enough of benchmarking, understanding what climes and what countries some of these solutions have worked. So we will have, for instance, countries like Egypt doing, again, there's a lot of understanding from the apex government about what they want to do with health investments, how they want to use medical tourism to be able to harness Africa's, health demands. Another one will be Rwanda. We're talking about public-private partnerships. Rwanda is the one country that has really adopted and clearly articulated PPP as a model from the government perspective to ensure that this works. So they're achieving two things doing that. They're generating the revenue required, but they're also helping the private sector to achieve its purpose, which is, the profit. They're stimulating demand and they are harnessing existing demand to be able to achieve that. We should do as nations more of understanding countries where things have worked on the African continent, not necessarily in Europe, because the parameters are different. And then we should use it to support one another.
Okay.
Over.
Well, thank you so much for those insights. Now we open the floor for an open mic. If anybody in the audience want to raise their hands, if they have additional question to ask, this is your time. The floor is open. Okay. Dr. Pat, are there any additional questions that are coming through while we are waiting for somebody on the open mic?
Chris Ngwa.
Yes, thank you so much. Can you hear me?
Yes, we can hear you, Chris. Go ahead.
Yeah, good afternoon. Dr. Chris Ngwa is my name. Health system specialist with UNICEF. And I'm going to ask one question, maybe to Prof. Do we believe, I posted the question in the Q&A chat, but that's something that we can reflect on from a more Pan-African perspective. Do we believe that the current matrices for health financing or benchmarking progress in health financing in countries are still meaningful? Do these matrices that we use, out-of-pocket expenditure, GDP per capita, amount of budget allocated for health, and health prioritization, do we believe that those matrices reflect the actual health system performance of member states in Africa? And should we be defining success beyond these conventional indicators, or should we be considering a new set of innovative matrices for use in Africa? Thank you. Over.
Any volunteer?
Chris, were you asking me? Okay, I would attempt to address a part of that. So Chris, my short answer is yes and no. I mean, there are matrices that clearly have problems. Of course, GDP as a measure of a country's income has always been criticized, that it doesn't accurately capture what a country is worth. And especially for us in Africa, GDP, there are many things that are not captured in GDP. Our massive wealth comes from resources. These resources are not converted, into outputs. So it's difficult to capture this. So yes, GDP, and therefore saying that if the GDP is $1 billion, then GDP, each person in the country, would be allocated maybe $1,200 per year is also quite theoretical, right? So GDP, the challenge is that what are the best matrices to replace these ones? I do not think we've come out with the best ones yet. But if you talk about some of the indicators for measuring health, yes, some of them also, one can argue that may not be very realistic. However, there are many others that I think are still useful. For instance, if we want to know how a government is performing now, we need to start by knowing how much the government is putting into health. Maybe per capita, maybe not per capita, but how much is the government allocating every year out of its budget for health? How much are households paying when they go to seek healthcare? I believe some of these matrices are still very important, even though we have the opportunity now to rethink, which other matrices would make sense better in our setting. But a wholesale yes or no is a tricky thing because there's still some good use of some of the current indicators, while others would need rethinking and rejigging. Over.
Thank you. I see time is really, really running. We have just two very quick questions, two hands that are up. If you can briefly ask your questions, and then we'll be wrapping up before 10:30. Who's next? I don't seem to see the hands that are.
Can you hear me?
That will be Jeremiah. Thank you.
Go ahead, Jeremiah, briefly.
Okay, thank you, great panelists, for some very thought-provoking conversations. I just want to ask, at the backdrop of what Dr. Atoki mentioned, that there's a lot of competition as well from other sectors for resources. So how do we practically galvanize local funds, especially now for healthcare, so that we can sustain some of the programs? We have made gains in Africa in the face of this dwindling funding gap we're experiencing, and donor funding as well. Thank you.
Thank you. Maybe we could just take also Adedeji's question, and then we will wrap up. Adedeji, over to you. If you can unmute Adedeji. All right. It doesn't seem like technology is working. So any panelists to give a very brief answer to Jeremiah?
Okay, I'm gonna give it a shot, and thank you so much, Dr. Jeremiah, for asking that practical question. Having really accepted the reality of this situation, if you're dealing with private sector, is to put pressure on government to make it an enabling environment. Is to put the right regulators, the right regulations in place, and tax incentives, like I said, to make it more attractive. The competition is not going to go away as far as investments are concerned. The attraction to health is not going to happen on a business level, on a business case level, if it's not clear that the ROI is competitive enough. Those are the hard realities. And I do hear you, it's concerning, but we're also proving that there's a lot undertapped, there's a lot unaddressed. There are a lot of needs. So we're saying government has the capacity to stimulate this demand. And so for me, for now, it's really driving towards the public-private partnerships model and opportunities, and see where, yes, it's not likely that the private sector person has the capacity to drive demand in the way that it will be able to give good account of his numbers. So get government to do that for you. And then you be focused on solving the problem and ensuring that you still, your bottom line is still what you want it to be. Over, Professor Otto.
Thank you. Thank you so much. Now is the time to wrap up. I think if panelists, you can come back on the screen so that we thank you properly for sharing your knowledge and experience with us. I just want to go through a few points that I will say as a key takeaways. The first one is that we need to keep focus on sustainability, have a clear roadmap. That is going to be the North Star for domestic resource mobilization. We need to know where we're going before we can be efficient. Prioritization, align the country priorities to the revenue streams so that we are financing the right things at country level. Political will, and there was this issue of the dilemma of countries becoming wealth, but the debt burden is eating away all the revenue that we are generating as a continent. We identified the PPP as an untapped resource, and we discuss a little bit on the how to engage with the private sector with a couple of initiatives that are homegrown in Ghana. I mentioned the community-based insurance, which was homegrown, and it is internationally recognized today as a viable health financing option. And in the short term, our experience has shown that it is important to have a fiscal contingency plan to cover the gaps, but immediately the gaps are covered, we need to start thinking long-term from a sustainability perspective. And how to tap in the PPP, the private sector resources. Important to acknowledge the fact that they are for profit, and we have to learn the language and their ethos so that we're effective in engaging them, and just accept that reality is that the private sector will call for profit and engage them at that level. So with those, I want to sincerely and sincerely thank you for sharing with us your time, and all the participants for the engagement and the questions. I would like to invite everybody to watch out for the next roundtable, which will be exploring the theme of leadership, governance, and the path ahead. This event will happen on August 27. Today we've seen the what and the how. Tomorrow, the next month, we're going to talk about governance and leadership. So please stay engaged with us by visiting our website. And to my co-moderator, fantastic co-moderator, I will call her my twin moderator, my twin sister, Dr. Derisu, thank you so much for the grace and enthusiasm. It's been a pleasure working with all of you. Until we meet again, thank you.
Thank you. Thank you so much.
Thank you. Goodbye.
Thank
It
you.
was a pleasure.
Goodbye.
Goodbye.
Good afternoon. Bye-bye.